Okay, hello, it's Garnet here, and we are continuing with the video commentary series that is paralleling the Neuro Light Practical Guide for Beginners. We're in the Help Right Now section, and at the end of that section we're focusing on the neuroplastic reinforcements. So if your pages are the same as mine, it's page 28, Introduction. This is really a profoundly important aspect of appreciating the Neuro Light. I say at public events, oftentimes, I begin by saying that the Neuro Light is not important, and what is important is neuroplasticity. If you appreciate neuroplasticity, and it's a tremendously exciting and growing area of neuroscience, of wellness, of healthcare, then the Neuro Light becomes very important. But the Neuro Light without the depth of appreciation of neuroplasticity might be entertaining or interesting or kind of provocative. How you use it, I think, will not be as efficient as if you would understand neuroplasticity. So, these are neuroplastic reinforcements. This is a short introduction. When you think about the Neuro Light, a Neuro Light session, I think it's wise to think of it at least in three elements or aspects. And these three elements are set within the very large domain of neuroplasticity. So let's talk about just before the session, the light sound session itself, and then after the session. So pre, and then session, and then post. What a person brings into the Neuro Light session is important. It's not that it has to be, specific. There's no real stress to make sure that you do something right, but the idea of what is normally called set and setting. Set meaning kind of what's going on inside of them, their idea, their expectation, their view, their attitude. And then setting is kind of the external element of it. The location, if you're doing it as a helper, as a light coach, then kind of your feeling, your vibe, the quality of the room, the ambience, sight, sound, clean, dirty. These are important factors because they set up a kind of preview or a getting ready kind of experience. So pay attention to that. Pardon me. In the Neuro Light channel that you're in now, I expect, Neuro Light Garnet on YouTube, there are other videos that explore what I call the interview style. If you feel like you need help in this set and setting, because sometimes a person will come, and remember this is Help Right Now, they're quite clear. They may say, yes, it's frustration or overthinking or lack of motivation. They can be quite specific in terms of the challenge that they're having at this time. And we've talked about that in previous videos. The transient or the aggravation of the chronic. But sometimes they're not so clear. And that's when the short interview style that I discuss in detail is important. You've got to get the ball rolling, and I usually use this provocative question, would you like more of something good or less of something bad? Would you like more of something good or less of something bad? And watch the videos if you want more insight into that. Expectations are really critical. If they think that, let's say that they're really in a frustrated state, and 11 or 22 minutes or 33 minutes, that one session is going to be magic and flip the switch, they're not frustrated anymore, that expectation may be too great. Now, you can always hope that it's like that. If a person has high vitality, if the challenge or the issue for the help right now is not really significant, guess what? Not bad. But make sure that the expectations are set within the context of neuroplastic change, which is really common sense. If you have a problem, let's say the frustration, you go to a psychologist and they give you advice and you talk and discuss, you might feel great relief in the session, but how you introduce that, how you integrate that afterwards is critically important. So pre-session set and setting. Then the session itself. Enjoy it, soak it up. Presence, attention, not alerted high focus, not holding some kind of thought in your mind. It's not, like laser, like specific focus. Just enjoy it, be open, be there. Think of it as the quality of attention that if you are watching a movie or listening to a lecture, the quality of absorbing in an open way with some clarity of attention. Great. And then you've got the post-session, which is what this slides into, the neuroplastic reinforcements, which is maybe a complicated way of saying, do you do things that help the probability of the compositions helping you? Or do you do things that will suppress or diminish or obstruct the signals? So the period following is what we're talking about here. And I think you're aware, or maybe not, that there is this grace period, as I call it, 1 to 2 hours following the actual stimulation, the light and sound, is the beginning of what we could call the digestion process, using the eating the meal analogy that you've probably encountered. That 1 to 2 hour period is a time of potentiated sensitivity. You can boost the effects from the light and sound by doing certain things, behaving in certain ways, or you can diminish it, you can obstruct it. If you just go back to the same o and you think magically it's going to change you, no, I'm sorry. Even in these short-term help right now aspects, keeping in mind that if you want things to be different, you're going to have to change. So be sensitive to that. And also, it isn't just the 2 hour grace period, it's the 12 to 24 hour period. If you're aware of the traditional Oriental medicine circadian clock, where it's divided into 2 hour segments, where you can see that the focus of metabolism, the self-regulation, the distribution of the qi follows a sequencing rhythm where it peaks and valleys in every 2 hour period throughout the 24-hour day. So here you see the 2 hour issue coming up again, recognized 1,000 or more years ago, maybe 2,000 almost, along with this concept of not just the 2 hour, but that 2 hour undulating through 12 to 24 hours. So much of the benefit, the evidence for the effect in a Help Right Now session can be right in the session itself, enjoying eating the meal, but don't think that that's the limit. Really, the deeper effects, the integration, what we could call the soothing or maybe even the learning, is something that goes on for some period of time, 2 hours, 12 hours, even 24 hours after the session. So this is where the neuroplastic reinforcements come in. The neuroplastic reinforcements, other than changing evident behavior in your lifestyle, the reinforcements are things that you can do, kind of as techniques, that will support the Neuro Light session and the goals, the vector. Now, you can get anxious to think, I've got to be really, really super specific in these reinforcements to make sure it aligns with the goal or the vector from the session. Yeah, there are reinforcements that can be really vector specific. You could imagine going to a physical therapist and having some therapies done, and then they give you, your take-home work, your homework, and they want you to do this and then do that, and it can be quite specific. Yes, that exists in neuroplasticity as well. However, the good news is that there are also neuroplastic reinforcements that are more generalized, that a kind of a one-size-fits-all can still reinforce the specific goals of a Neuro Light session. In this case, we're talking about Help Right Now, but that would be true of the brain gym for brain exercise, increasing vitality, maintaining vitality of the brain, and also even in the brain shaping, which is something that we'll touch upon, keeping in mind that this guide is a guide for beginners, and brain shaping is really a style of neuroplastic work. It's the work of a light coach using the Neuro Light that takes some maturity in understanding and the ability to recognize the evolution of experience in a person. You can do it, and depending on your training, you can do it faster or maybe not quite so fast. So here, what I'm going to do is introduce 3 kind of one-size-fits-all neuroplastic reinforcements, and you can pick and choose the ones that you relate to the most, the ones that if you're doing it for yourself or if you're doing it as a light coach helping somebody, you can get a feel for what they're going to do. In the past I did a lot of work in somatic body work, a lot of sports medicine, a lot of massage therapy and body work and so on, and even in other things, homeopathy and biofeedback and so on and so on. I was oftentimes asked, what is the best exercise for me? What is the best exercise? A person would ask me. And my answer was typically always the same, and not being facetious, not making a joke, but the truth. I said, listen, the very best exercise is the one you're going to do. Because, theory doesn't make much difference in that case. So, compliance, finding a neuroplastic reinforcement that the person will actually do is much better than some idealized perfect one that's going to be so amazing and powerful. The fact is they can't relate to it and they don't do it. So let's have a look. This is the introduction. Help Right Now, Neuroplastic Reinforcements, part of the video series running parallel to the Neuro Light Practical Guide for Beginners document. Thanks.